Today's topic is pathogenicity in infectious diseases. First, let's talk about our host and our parasite. Hosts are large organisms that support the growth of smaller organisms, where parasites are any organism that causes diseases and metabolically depend on the host to grow. An infection is when a parasite is multiplying its population without any control, is taking over and ruining the host's usual processes, developing diseases. A pathogen is the actual organism that causes the infectious disease. They are divided into primary and opportunistic. A primary pathogen causes diseases by direct interaction with a healthy host. On the other hand, an opportunistic pathogen is always present in the environment but can only infect the host when it's immunocompromised. Pathogenicity is the ability of a parasite to cause diseases. For a host to be infected, there is a chain of reactions that needs to occur. In this chain, there needs to be an agent who needs to have a certain virulence factor to be able to survive in a host. The agent needs to be exposed to the host in a certain dose, but it also depends if the host is susceptible to the agent or not to determine if the infection occurs. There are sources of pathogens. The transmission of pathogen occurs in two different ways, direct and indirect, which is also known as vehicles. The direct transmission is divided into four subcategories: horizontal contact, airborne, vector, and vertical contact. Indirect or vehicle transmission is also classified into contact, food/water, and airborne. For the pathogen to be successful in the host, it must have an entry and exit portal, find a safe environment, acquire nutrients from the host, and establish a niche. Without this, it will be unsuccessful. A toxin is a substance produced by a pathogen that damages the host, whereas intoxication is the result from entry of a specific toxin into the host, and toxemia is a condition caused by toxins in the host blood, which in most cases are fatal. Infectious disease is anything caused by a virus, bacteria, fungi, or protozoa. Signs can be directly observed on the host. Symptoms are changes that the patient experiences. Disease syndrome is a combination of signs and symptoms that describe how the disease looks like. Time course of infectious disease express the relationship between time and how long the pathogen stays in the host from the point of exposure. Beginning with the incubation period, pathogen enters and there's no signs of symptoms. Following is the prodromal phase, where signs and symptoms start to show, however, not enough for diagnosis. The period of illness is the most severe and is where signs and symptoms are fully shown. This stage can result in death if illness is not treated, but it can be treated to arrive to the final stage, which is convalescence, where signs and symptoms begin to disappear. The infectious dose is defined by the number of pathogens that will affect 50% of the experimental group of host cells in that specific time. This varies within a pathogen. The idea is that you count how many pathogens you would need to infect 50% of the group of healthy hosts. The less pathogens you add to infect the 50% of host cells, the more effective the pathogen will be. This is why hand washing reduces the number of pathogens. The lethal dose is the dose that could kill 50% of the population within a specific amount of time. The less you need to add to kill 50% of the population, the more effective the pathogen is. Host susceptibility is one of the most important factors for an infection to occur. It's divided into defense mechanism of the host and the pathogenicity of a pathogen. Nutrition, genetic disposition, and stress also play a role in the infectious process.